Hi, I'm Dr. Molly with Your Goals Physical Therapy, and I wanted to go over SI joint pain. So what is SI joint pain? When do people typically have symptoms of SI joint pain? And then what is a stretch you can do to help this SI joint pain? Okay, so we're gonna start with what causes it. So there are many things that can actually cause SI joint pain. So it's really hard to give a firm reason without a hands-on physical exam. That joint, because it's where your spine and your hip connect, do a lot of things. It moves in a lot of different directions that you wouldn't necessarily think of. So really your sacrum can be tilted one way or the other, and then that can cause that joint to either be moving too much, not enough, or maybe even being slightly out of place, or something called subluxed. So it's just slightly out of joint. And all of those things can cause pain. And typically what happens when you have SI joint pain is that you have like sharp pain standing on one foot. And so any activity that does that, typically big complainers would be walking and going up and down stairs. If you're kind of having problems in like a sports setting, a lot of times it's running, especially when you're landing on that one foot. Some people complain about having pain when they do their squats, or when they get all the way down to like parallel, they get a little basically a hitch. They feel some discomfort in their low back. So all of those things can be from, laying flat. That's another big one. People, going back to sleep or trying to go to sleep, and they can't lay flat on their back anymore. And so, so those are all kind of like the times that people complain about pain. Now, what can you do right now as you're sitting at home watching this video? So I'm gonna show you a stretch. So you're just gonna sit in a regular chair. And I would start this on the side that doesn't hurt. So like if it's your right side that bothers you, then I would try moving your left. I'm doing this backwards, but I would try moving your left, because that way you can see how it feels and control what's going on, right, when you do it on the side that actually bothers you. So I'm gonna do this with my right leg. So I'm gonna cross my right leg over my left knee. And then I'm in this position. If I can relax kind of comfortably here, I'm just gonna pull this knee towards my opposite shoulder. And I'm just gonna hold that position just to try to get a pull down here. And now this should not hurt. It should just be mildly uncomfortable, like a stretch. And you wanna try to hold that for 30 seconds to a minute. Long enough that you actually feel that muscle in your hip kind of relax. So we're just gonna hold it, and then you would let it go. Now I have a second variation to this one. I like also to push down. So if I take the same side hand, so in this case, since this is my right leg, I'm gonna push down with my right hand, and I'm just gonna push down, and I should feel a stretch kind of on the outside of the hip here versus on the part of hip here. And if I just press and hold that again, I'm just going until I feel a little bit of a pull. It should not be painful. It should not cause sharp pain. It shouldn't do any of those things. You just feel a mild pull. And you're just gonna hold that for 30 seconds to a minute. So those are the two kind of easy stretches that you can do sitting at your office chair, your kitchen table chair. It's a little hard to do from a couch, but you get the point. And that should help alleviate some of the symptoms. Now, what happens if that doesn't get rid of all of your pain? Does that mean you're a lost cause? Not at all. As I said before, there's so many reasons why you could have that SI joint pain, that it's really hard to give specific things for what's gonna help you. So you would want to come in and see a physical therapist to have a full hands-on assessment. And if that's something that you're interested in, simply direct message me, and we'll get you on and set up for an evaluation to help you feel better starting as soon as possible. You have a great